afternoon, depending what part of the country you are in, and thank you for joining us. My name is Jenny Pagel-Guile, and I am the Executive Director of the National Pancreas Foundation, and we're excited that you're able to join us today for today's topic, mental health awareness and chronic illness. We are proud to partner with Mental Health America. We've worked with them. This is our fourth webinar to provide information and services and thoughts on coping with chronic illness and the mental health effects that go along with that and some of the health struggles associated. So we appreciate them helping us address this vital need in our community and look forward to today's topic, which will be recorded and shared online afterward. Again, with the National Pancreas Foundation, we're excited to partner with this and hope that you'll follow through on the slides and look at other opportunities where you can join us, but this is not pancreas only related. So I hope that you all glean some information from this. I would now like to introduce our speaker today, Dr. America Paredes, and she is the Chief Social Impact Officer at Mental Health America. In this role, she leads the implementation of MHA's forward-thinking, equity-focused approach to change by developing and implementing innovative partnerships, strategies through a social impact and systems transformation framework to advance MHA's work through measurable change, collective action, and community engagement. And I am going to turn it over to her to begin facilitating and leading us through today's discussion. So again, thank you all for joining us.
Hi, everybody. So good to be here with you all. Like Jenny said, I'm Dr. America Paredes, she, her. I would love to just say hello to everyone out there, our MHA partners, including MPF, and our affiliates that are joining us today. So appreciative of you spending time with us and appreciative of the folks that are going to be part of the discussion today. So we are going to be talking about how we navigate medical trauma and what that means. And we're going to really set the stage for us to really have a fruitful conversation. So part of that is really setting the stage for what medical trauma is. And we're using a definition that really focuses on the emotional and physical responses to pain, injury, serious illness, medical procedures, and frightening treatment experiences. And we're using that as a basis for the overall conversation. So when you want to think about what your experiences are like and or how you navigate these conversations and these experiences, the folks that are with us today are coming at it from a lived experience perspective, as well as the professional perspective. So think about how medical trauma has shown up in your life, how it impacts the folks that you may be working with, and what you can do to really help set the tone for creating a very trauma-informed space. And that's what ultimately we really want people to walk away with, not only in helping individuals validate their experience about what medical trauma can look like in their lives, but then coming away with that and saying, what can I do as a person who is either providing support, maybe I'm a caregiver, maybe I'm a person with lived experience, what I can do to not only advocate for the things that may be needed, but also help others understand why trauma-informed care is really important and helping them understand that it's not just a one-time thing. We have to really integrate this into our mindset so that we continuously focus on how we can create these spaces that are welcoming, not damaging, and ultimately welcome you back when you need it. So I'm going to introduce our presenters today. Our first presenter is Dr. Brooke Palmer. Dr. Palmer, wave your hand so everybody can see you. There you go. Dr. Palmer is a licensed clinical health psychologist with the University of Minnesota Medical School. She supports patients in coping with emotional and behavioral impacts of living with acute and chronic health conditions. One of her main clinical areas of focus is working with patients living with chronic digestive issues and disorders of gut-brain interaction, and she conducts pre-surgical psychological evaluations for patients pursuing TPI-AT. And then we have Jennifer Jones and Karys Durham. Jennifer Jones and Karys Durham are both pancreatitis patient advocates. They work very closely with NPF. They have both lived with pancreatitis for many years, and both were actually diagnosed at different stages in life. Jennifer is currently the NPF Chicago chapter chair, and both promote pancreas disease awareness on a regular basis and ultimately are here to really share their experience with us. So I'd love for a moment just for everyone to say hello. Dr. Palmer and Jennifer and Karys, please go off mute and say hello and just tell us two little things about you that make you special about who you are. Anyone can go first.
Who's going to go first? Oh, man. I'll go quick. Hello, nice to meet everyone. Brooke. Two special things. One, well, I have two dogs and they're very special to me. So I'm a dog person, I'll say that. And I'm an only child. I feel like that's not as common these days.
Well, Dr. Palmer, you can't tell us that you have dogs and not tell us what breed, because I'm a dog person.
Golden Retriever and a Sheepdog Poodle mix, and they're both very
Fabulous.
sweet and cuddly. Thanks.
Awesome. Awesome. Jennifer, what about you?
I come from a family of 8, including myself, 7 girls, 1 boy.
Wow.
And my favorite band is Coldplay.
Fabulous choices and a big family. Great. And Karys?
I'm a big Taylor Swift fan, diehard Swiftie. And because of everything I went through with my chronic illness, I want to be a child life specialist in a children's hospital.
Well, that's fabulous. That is great. Good taste in music. And you want to do more with your life around what you can do to help others. So that's fabulous. So we're going to spend some time today talking about a range of different things tied to medical trauma and what that means. So if we can, I'd love for both Jennifer and Karys, whichever feels comfortable, in talking a little bit about what your expectations were coming into medical kind of care. I understand both of you all were kind of diagnosed earlier on, but talk a little bit about your experience and what your expectations were around that.
So I'll start. So my expectations, I was diagnosed at an early age, at different stages throughout my life, as all of you know. Chronic pancreatitis or most autoimmune diseases can put you in remission and then return at different stages. So diagnosed early and then it returned. And along that road, my expectations every step of the way was for my providers to be a beacon of a safe haven, a place where I can feel like I'm being heard. There's a level of understanding and trust there.
Very important. What about you, Karys?
I had stomach issues my whole life and we couldn't really figure out what was going on. I ended up getting my diagnosis at age 15 of chronic pancreatitis. But I think when I was first going through it, you grow up thinking like doctors are kind of your safe place and they're supposed to know everything about everything. And so, especially pediatric doctors, and I think my expectation was kind of, oh, I'll just go in once and they'll know right away what's going on with me.
That is that's very important to think about, the ideas that we come into with these spaces, right? And understanding from your experiences, it was really one, you'd have to ask yourself why it is that you had these thoughts, right? Like you believed in the medical care that you were going to receive and that the doctors had all the answers, because that's kind of taught, right? Like you need help, you go get it. They're going to tell us what's wrong, and then you can move in a direction of finding help, support. But that's not always the case. And I think that's something that people oftentimes have to manage in their experience. And then you also talk about this safe space. And I think that's one of the most critical aspects of any of the work that's done within healthcare. And the idea that we come into these spaces feeling very vulnerable because we don't have answers. And from that, when you may not have that feeling of safety for various reasons, which we'll get into, then you kind of create this whole thinking that, is this what it's supposed to be all the time? And the negative impacts of that, I think, are really important. Dr. Palmer, do you have anything to add around what you think the expectations are for folks coming into these spaces?
Kind of what I see in patients as they
Mm-hmm.
are learning about a diagnosis. Yeah, I think I really like the point about this expectation of I'll figure it out and then we'll treat it. And I think that is very classic. And, when people go on to develop maybe a post-traumatic response, it can really occur when there's this really big difference between what we expect and reality. And we do have such a hopeful expectation of trust in our providers. And even if that's met over the long term, but not up front, it can really be challenging to kind of like get back on track after that initial breach. So I do see that in quite a bit of patients I work with, and expectations matter. And I think like the topic of flexibility, or the concept of flexibility, I think is really important as patients are going through their experiences. Being flexible, that the providers are human, we're human, and trying to figure it out as well as we can.
I totally agree. I think one of the issues that comes up in that space, though, is like when you are a child or you're coming into it much earlier, you may not be the one that even has the words to be able to speak up and say something to that effect. So how do you then tell like your parents or your caregivers, hey, this isn't the thing that I wanted, this isn't what I expected out of this experience? So I think that's really important to also have in the back of our minds when we're really thinking through how we can create these safe spaces. Karys and Jennifer, talk to us a little bit about what type of trauma you've experienced within the medical system. Karys, what does that look like for you in your experience?
My getting to my diagnosis was very challenging. And as many chronic illnesses are, my pancreatitis was not just like textbook. It never showed up on CT scans, anything like that. The only thing was my blood work was a little off. And so doctors very quickly started telling me that it was just all in my head, and I was just an anxious high schooler trying to get out of high school. And so I think that was very traumatic for me, and I heard it for so long because it took me about a year and a half for them to finally realize it was pancreatitis. Um, it Going through that process after a while, from hearing it from people you trust and from professionals who've studied this their whole life, I started to believe that it was just all in my head. And that was very mentally damaging for me because, if you do get your diagnosis, you kind of see some light at the end of the tunnel, like, okay, there's things we can do to kind of manage this. But when it's just in your head, I was very quickly like, oh my gosh, I'm going to have to live with this my whole life. And so that was very challenging for me. And if I didn't have the support system that I did at home, um, I think it would have been very, very bad. But my parents luckily like believed me and kept telling me like, okay, like we'll figure this out. And we kept going to new places and stuff like that. But believing them was very damaging for me, and I questioned myself daily. I completely pushed away everyone, and then I wouldn't want to tell anyone when I was in pain because I didn't want to go to the ER and hear them tell me that it was all in my head. And then it also turned into, oh, she's just a 15-year-old, she wants IV pain meds. And so that was also a big thing for me, was no, I'm not seeking pain meds, I'm seeking pain relief, which are two completely different things.
I'm so sorry that you had to experience that, Karys. But it's not surprising from the other experiences that I've heard from folks. I'm going to let Jennifer respond to that question, and then we're going to talk a little bit about some of the similarities that may come up. So Jennifer, how was your experience in dealing with trauma within the medical system?
So having the condition as a child, my parents were my advocates. And, my mother was really good about making sure she jotted everything down and keeping a journal, and totally okay with getting second opinions. And so, when it returned as an adult, you know, being in this new space, I definitely had to prove, similar to you, Karys, where you had to prove that you're saying like your symptoms are consistent with what's on the test. And sometimes that might not be the case. But the biggest thing for me, I'd say, is the gaslighting that occurs. So, piggybacking off of Karys' sentiments, where you're describing what you're feeling and the symptoms that you're going through, and they may not be consistent or show up on the test results. That doesn't mean that what you're experiencing is not accurate. So it makes you question whether, is this me? Is this all in my head? Like, what? Like, I don't know. Maybe it is me. Maybe this is. So then, maybe you need to go. Then it becomes like maybe you just need to walk more, or you need to, you know, stretch out a little bit, or just these menial things, and it starts to take away from, uh, you know, where you are and the truth in the space that you are with all of that and doubting that. So that's big. One of the other things is like smells. Sometimes, like after having so many procedures and stent procedures, I wake up, or even a surgery, wake up and smelling that first like smell in a hospital room is, that brings on a trigger of anxiety. And I start to look around like, who's here? Is there someone here for me, you know, that knows me? And I'm looking around, and of course I have my support system, but that can bring on anxiety. Certain foods that they have you rotate, broth, jello, ice chips, those are the classics. And after a while, that starts to be redundant. And when someone else just offers it to you, just on, this is all I have right now, it can be like, oh no, no, thank you. But it those are things that definitely will be triggering.
Thank you so much, Jennifer and Karys. I'm jotting down notes, and some of the things that come through in both of your experiences is this feeling of isolation, um, and having to navigate that. Even if you have a support system, you have to be able to communicate what you're feeling. And then when somebody tells you, and this is, within the pancreatitis community and outside of it, mental health conditions, anything, there really is this questioning where you have to prove to someone, no, I'm not making this up. I am actually feeling this way. And sometimes we don't even have the words to help others understand what it is that we are feeling, right? And especially for medical providers, they want us to tell, like, no, I think it's my toe, right? Like that's the thing that's hurting, but it's actually not that. And we rely on them to help us understand, well, the pain that I'm feeling is actually not there. It's in, connected to a nerve in my neck or something. And that in itself, the mistrust that comes about because of these situations that you encounter is a very heavy toll to carry as you then navigate, especially with chronic health conditions where you may today feel like, great, I had a better level of support, and then tomorrow you have a different provider and they kind of knock you down back to the beginning, and you have to then again prove what it is that you're feeling. And some of the stereotypes that come through, and the biases that come through from providers, and how they approach these situations. Not only, I know in the pancreatitis community, a lot of the symptoms are often associated with people who are seeking opioids and things of that nature. And the reality is like, no, I love, Karys, what you said, right? Like, it's not that I'm seeking any kind of drugs. I'm actually seeking help for my pain. And having to validate that is really troublesome. The other thing, to Jennifer's points, some of the things that we don't necessarily associate with medical trauma are the sounds, the smells, the foods, and what that does physically to your body when you're navigating these spaces. And ultimately, even putting that into words by saying, like, how can you tell someone when you're coming out of like anesthesia, I need this type of support when the teams that are part of that change continuously? So part of that is then thinking through some of the tools that you may implement for future awareness and providing these to the people that are in your lives so that they can help manage that. Now that we've talked a little bit about that and you're moving through these experiences, in what ways are you managing and responding to the emotions that come up?
I know for me, one of the big things, it's more of a negative, but I tend to try to push people away when things get bad. Um, at one point, I had a doctor tell me that I was wasting my parents' money and that I was a burden, and I just needed to stop faking it and putting on a show because it was messing with everyone else's lives. And so that was a big thing for me. And even though it was a 15-second conversation for him, 4 years later, like I still think about it every single time something goes wrong. Um, I have a great support system. Never once have they been like, this is too much for me, but I have a tendency to try to push people away. So I think that was a big thing for me. And just back to the trust issues, I have a lot of trust issues. Like, I ended up having the TPIT surgery, so I don't really have a lot of organs left except the ones that I absolutely need. And anytime my stomach hurts, it's kind of a running joke in my family, like, Karys, you don't have much left for something to be really wrong. But anytime I have to go to the ER because of pain and stuff, if they do all the workups, all the scans, and they come back and tell me that everything's normal, I question them because I'm like, you told me everything was normal for a year and it was definitely not normal. So that's a big thing for me, is just questioning, like, and I think also never getting closure. Like, I ended up transferring hospitals after I got my diagnosis, and went to a different hospital to get my surgery. And so I never really got closure from those doctors that did say those awful things to me. So that is sometimes a big thing for me as well, is not having them being able to like apologize or say, we were wrong, you were right. And so that's probably the biggest things for me.
That's so tough. I just want to like sit in a room and just tell people, like write an apology letter. But, there are things that bind people in a way that is so outside of our control. And it's hard to manage that. Um, Jennifer, what about you?
So after some time has gone by, after I've had a procedure or a surgery, um, I remind myself of what's around me and try to stay in the present um, area of where I am instead of allowing I think we all on some level overthink. Everybody's just, everyone's different, right? With how theirs comes about. But for me, after waking up, I have to look around. Maybe it's that first, you know, air or breeze from a window or the door opening that kind of jolts you back to where you are in the present. That helps a lot. And sticking to the facts. So I'm in the hospital because X, Y, and Z. And, that's it. Kind of leaving the emotion out of it helps, because the more emotion you put in it, the more complicated it gets and the more traumatizing trauma it's doing to you mentally here. So it may not be doing it outwardly anymore, but it's constantly giving you more trauma mentally. It's like replaying the event over and over again, and it feels fresh.
Right.
So, um, you know, it for me, to those doctors that have done that, I've written mantras for myself. I'll put down things on my phone like, I'm imperfectly awesome, like imperfections and all. And, the ups and the downs, the cries, the spills. Um, and I also kick butt, like, in the best way. But yes, all of those things. And I will speak for myself, even though, this doesn't match that. The facts are, this is how I'm feeling. These are my symptoms. That's it. Like the rest is just nothing to say. There's nothing else to say from there. But that's difficult to do. It's easier said than done. So it's a practice, definitely a practice.
I love that, Jennifer, but I also know that in the realm of how we speak to ourselves across all things, we most often we don't say very nice things to ourselves. And because of that, we tend to really have intrusive thoughts that push us in a direction of negativity. And it is a lot of work that we have to do daily, minute by minute, to say, no, let's stick to the facts. I love that, to be able to say, let me take the emotion. And sometimes that helps because it helps us bring us back to the present. Um, the other thing you guys are also talking about is a little bit about of this anticipatory anxiety, like what is this going to look like all the time? And that anxiety in itself is impacting your overall well-being, but physically also, right? It's managing how you can then go into these spaces, even with the foods that you're eating and how it's going to influence how you feel. And I think within the chronic health space, that's something that comes up quite regularly, and introducing new things and what that feeling may feel like and what it will do to your body. And part of that, I think, sets us up for this conversation around what you can do to navigate some of these issues and how you're navigating, based on all the things that have really shaped you up till now, how you now navigate the medical system. Karys, you talked a little bit about not getting closure, and knowing that, does that change how you now navigate these spaces? That you won't have that closure? What do you do to help you?
I think my big thing is I've learned to not stay silent, and even though they are doctors, you can still stick up for yourself because in the end, these doctors have gone to classes, read the books, done all the work, but they've never experienced the things you're going through. So that was like a big thing for me. And when I first started going through everything, I kind of hid behind my mom and dad, and I'd be like, I'd tell them what to say to the doctors. And my mom finally looked at me one day and she was like, I'm not the one in pain. You are. You can tell me everything you want to tell me, but I'm not going to express it in the way that it needs to be expressed. And so, like, even now, I started going to my appointments by myself right when I could drive. I'm 19 now, but I was going to my appointments at 16. And um, when I would be admitted to the hospital, like obviously my parents would stay if I wanted them to, but most of the time I wouldn't want them to, because especially I think when you're a pediatric patient, they kind of look at the parents and they question the parents, explain everything to the parents, and it's like, I'm the patient. I know I'm not 18 yet, but I'm the patient. I'm the one who wants to be making these decisions. And yes, I want my parents to be involved in that, but I'm the one who needs to be answering these things, and my parents aren't going through it as much as they're experiencing it with me. I'm the one that's having to endure all this. And so I'm forever thankful. At first, my mom was like, you need to speak up for yourself. And I was like, absolutely not. Like, I'm 15. I don't need to be doing that. But now, like, again, the doctors aren't the ones that are experiencing this. You are, and no one can fully understand what you're going through unless they have been through it themselves.
Oh man, that is amazing. I think for all of the work that we intend to do, if nobody takes anything away, but that around self-advocacy, right? Being able to have a voice and owning that voice and being able to say, no, I'm the one that says what's happening. Jennifer, what about you? How are you navigating these medical systems now?
Like Karis, I 100% agree with you. I had a surgery about 5 years ago. It was a transplant surgery to try and help a lot of the gut issue and the issue with the pancreas. But, I found out this year that the transplant failed. And so, you know, in this last year, I found myself in this space where I've been trying to advocate for something else that was happening within my body. But, you know, I no longer have that organ. So then it was like, how do you explain that? So I just, I would say my mother was really a good example of writing down notes and getting a second opinion, and then just being that advocate for yourself. So, is it okay if I just share something really quick when I was younger?
Of course.
Okay. So when I was about 8 and we were trying to figure out what was happening with my body, and, because I'd wake up in the middle of the night in pain, and it was just completely unexplainable. Um, After a while, one day they did blood tests, and I was going to my regular pediatrician, and she came running back in the room and she said, her test results show that she needs a liver transplant. And, you know, I'm like looking like, huh? And my mom was like, what? Like, but she still had her note, her journal of what I had eaten that day and the day before. And, it was like, okay, what's the second option? The second option was to go to a GI specialist. And that was the best decision, you know, she ever could have made. I don't even know if I'd be here talking with all of you beautiful people today. So, you know, once we went to him, it wasn't too long thereafter that we found the true diagnosis. So it's that waiting game, and then still sticking to, being that advocate for yourself. You know, it's your time is coming, but it's just like, in the meantime, okay, how do I deal? But it's finding those things, in between, maybe hobbies that help, after an appointment, or keeping the right group of support system with you all along, through the way.
Yeah, I love that.
But also gonna say one more thing. I saw someone in the chat mention this. You are allowed to change providers. Like if you have a doctor that you don't fully trust with your life, you are allowed to go get second, third, fourth, fifth, however many opinions. It took me like 5 doctors to get my diagnosis, and I would go to my mom and be like, I'm so embarrassed. Like, it definitely looks like I'm seeking stuff now because we're just changing providers all the time. And she would tell me, like, no, we're finding someone that we fully trust. And I had so many diagnoses that they would just kind of throw out, oh, it's this, oh, it's this, oh, it's this. And then we'd go to someone else and be like, no, there's no way that it's that. So if you don't absolutely trust your person with your life, like it's okay to go and get other opinions.
It totally is, Karys and Jennifer, thank you for sharing all of that. I think some of the things that you reference around having your support system there, and for you all, it really has been your parents that have been there throughout, that have not only been taking notes, right, and has a journal of what's going on, or your parents giving you the space to also own your advocacy, which I think is really important for caregivers. When you come into this as a caregiver, of course, you're concerned for the well-being of the person you love, but there's a moment where there's some independence that is required as well from the person living with whatever, right? Living with the chronic health condition, and what the caregiver can do to help aid that person along that journey, and either becoming a better advocate for themselves and them supporting that journey, right? Not taking over. And also, Jennifer, your parents send you a wonderful message. I don't know if you saw it. They said you're wonderful. But knowing that you can rely on them, right? And in many ways, that's a blessing. And for others, they may not have those support systems. So it's also finding support groups and others, like today when we're talking about these lived experiences, where you can go and share, to then have your feelings validated, right? To say, I've had this experience. I thought it was all in my head. I've talked to 7 people, they're telling me different things. And if nobody can help you say, yeah, that was the same thing that happened to me, we often feel so alone and isolated in our journey. So having that opportunity to connect with others is really important. Um, Dr. Palmer, I want to involve you in this conversation as well, because the thing that comes to mind is what you think, the healthcare system can really do in terms of not only discussing trauma-informed care, but providing that space. What does that look like for you coming into this conversation?
Yeah, it's a great question because we don't do it very well and we're trying to do it better. When we talk about trauma-informed care, it's becoming more of a common term, and maybe people have heard it, maybe not. But the idea is it's shifting from this perspective of looking at a patient as, what's wrong with you, to what have you been through? What have your experiences been and how has it shaped you up until now? And if we're talking about medical trauma, that's going to be, what have your past medical experiences been? And as in the healthcare system, we really need to be better about having conversations with patients up front. Kind of, have you had this procedure before? How did it go in the past? Because what seems like a routine test or procedure to us might be associated with trauma for a patient, and we don't know unless we ask. So we need to be better about opening up that conversation from the very beginning. And I did just want to share some of the core principles of trauma-informed care really involve integrating these aspects of safety. That's a big one. Helping patients feel safe, not attacked, not criticized or disbelieved. For example, one of the words that was coming to my mind when Karys and Jennifer were talking is just this sense of helplessness that must have been part of the journeys. And when you're not sure what the diagnosis is and no one's believing you, it's really hard to feel empowered. So we want to create safety, we want to empower patients, and we also want to create this sense of transparency. Letting people know what's going on is a big aspect of trauma-informed care, because it feels like things are happening to you without your permission, and we want to create as much opportunity for informed consent, letting people know what's going to happen, letting them ask questions. Such a big deal. That's a way to kind of get rid of anxiety or minimize anxiety if people feel informed. We want to avoid re-traumatizing them. That's the biggest thing. We don't want to perpetuate further trauma if we can. So those are some thoughts, just generally.
I think where the conversations go most often, I think with medical providers, anyone that really works in the field, if you're not really attuned to what trauma-informed care is, it really is a shift in thinking for yourself and your team to be able to help set up this environment where you're the one that's really interested in learning from the individual with lived experience, instead of coming in and saying, I have all the answers. Where, earlier we talked about how Karys, Jennifer, both of you all came to this like, well, the expectation is that you guys are going to have the answers. But what you've learned over time is that you have a lot of information about your experiences that these individuals have only learned about. Unless they also live with the chronic health condition, then they cannot really connect with that aspect of your life. And so it is really important around the opportunity to not only ask questions, but also telling the provider, like, this is what this looks like for me, and then being open to receiving that information, right? So for all of us, I'd like to hear from you all in what ways you think individuals can also learn how to advocate for themselves if this is new to them, and they may feel a little bit, nervous about saying, no, I don't want that, or how does this help? What are some ways that we can help others understand how to become better advocates?
I know for me, I would when something would come up, I would allow the doctor to leave. I wouldn't do it right then and there. I think taking a minute to breathe and kind of process what you're feeling is important and not just blurt out. And then I would go on my notes app on my phone and I would just type whatever I was feeling. And, you know, it seems vulnerable, but allowing the doctors to know what you're feeling, there is a small percentage of them that aren't gonna validate what you're feeling, but there are some of them who truly they have so many patients every day, and not that that's an excuse, but they don't realize that their 5-minute conversation with you is having as much as an effect that it is. So being open and honest with them, I know there was one doctor personally that I had a lot of issues with, and we ended up calling like a meeting. It was with him, my mom, and me, and I explained like the words he was using, the things he was saying were affecting me mentally and really causing me trauma. And he sat there and he actually had tears in his eyes and he was like, I'm so sorry. Like, I had no idea that I was causing you that much pain. And we sat there, and then from then on, every time he came into the room, he'd be like, okay, he'd kind of let me take charge. He'd be like, what's our plan for today? Like, what do we need to work on? Like, what are things that have been better, not as good? And I know for me, like, the pain scale was like a big thing for me because everyone's pain is completely different. And so when I would say I was in a 10 out of 10 pain, and they'd look at me and be like, well, you don't seem like you're in a 10 out of 10. If you were in a 10 out of 10, you'd be huddled in a ball, screaming, crying. And I'd be like, no, that's not really it. So, one of the main things at Minnesota that really helped me after surgery was, instead of saying, um, out of 1 to 10, what's your pain? They'd say, okay, I want you to name one thing that's better today, one thing that's worse today, and one thing that's kind of stayed the same. And so I think that was a big help for me.
Jennifer, what about you?
So I want to just clarify um, you're asking about how we advice to give for other individuals to
To
be
how do we
advocates for
come?
them.
Mm-hmm.
Yeah. So I definitely would say, write down what you are going through. That helps a lot. Um, you know, if it's a picture, I mean, these doctors have seen everything. I don't think there's anything they haven't seen. And honestly, just being as transparent as you can. I saw a couple people write in the chat role playing, maybe role playing with someone before going about what you'd like to say, and just like some of the things that are, standard or default things that some doctors may say, but knowing in the back of your mind that you are not alone in anything that you're going through. You may not see it presently, but behind the scene, there is someone, whether on the same floor, in the same hospital, in the neighboring hospital, going through the same thing that you are. So, you may cross paths one day, you may not, but knowing that there are others out here going through the same thing and also trying to advocate and be heard for themselves. So don't give up.
Thank you for that. And some of the things that have been referenced, and I'm reading through the chat as well. We're talking about the fact that it's not just the doctor, right? It's the other practitioners that are in that care facility, whatever that looks like. Everything from the front desk receptionist who's kind of receiving you, all the way through the folks that are providing care in different capacities. And I think it's important to think about what medical providers can do in those spaces to create really a trauma-informed care system, right? That it's a whole framework. Everybody's really following through with that. But the other thing is when we speak about being able to advocate for yourself, I think it's very important to also think about the biases that come into these space from these folks that may be helping us in our journeys, right? The medical providers. And something that continues to happen, unfortunately, is the fact that for people of color, the ability to actually say and voice something may not always be received as well as it would be from an individual who is not a person of color. And within that, that also can be very re-traumatizing. And we may not have the opportunity to seek out other providers, right? We're limited in what we can actually do. And within those confines, I think we can still manage to create an opportunity for people to not only feel validated by saying, right, to ourselves, I think a little to what you were saying earlier, Jennifer, that we are of value you are rocking it every day, right? And I'm coming into this because I need help. And at the end of the day, that's the thing that is really important to like carry with you as your mantra. Um, I'm going to take a couple of more moments so that Dr. Palmer can give us some ideas about things that we can do. And then for like the last 10 minutes, we're going to see if we can take some questions. But Dr. Palmer, tell us, what are some practical techniques for managing some of the anxiety or even panic attacks that individuals may have um, in these experiences?
Absolutely. I did just want to add something about the advocating as well. And one thing that I found to be helpful with patients, and it's also an anxiety reduction strategy, is our care teams are so big these days that if you have an ally on your care team, maybe it's the dietitian you've been working with or a nurse that you're very comfortable with. I think that's also a really useful tool. You can kind of maybe even run something by them or rehearse something with them and role play. A lot of times we meet as teams, and it's nice to know there can be someone kind of speaking up for you in that way as well. But as far as anxiety management strategies, rehearsal, either like mentally or the role play, is a really, really helpful thing. If there's an upcoming procedure that you know what to expect, you can kind of be going through it in your mind and doing relaxation practices at the same time. So you can start to kind of try and separate the event with feeling so anxious in advance. And that's something that feels like you're gaining a little bit more control, because the things that keep us anxious are things that are outside of our control. So any way that you feel you can exercise your agency and skills is really useful. In the moment, if you're feeling like a panic attack is coming on, usually signaled by this physical, like their chest tightening, it's harder to breathe. Doing grounding practices is something that's really useful. And this is something Jennifer was describing with like just focusing on the facts or what's happening now. Sometimes it's kind of like listing what you see around you, or doing some very simple mental exercises, like counting backwards from 100 by sevens. We don't want to do complex math, but just engaging your brain a little bit more can disengage it from that panic response. Another thing that is crucial, especially with panic, is kind of reminding yourself that if it's been medically checked out, and I saw someone in the chat reference, like, we want to really make sure that we're not telling people it's in their head when it's something medical going on. But if it is a panic attack coming on, it's not going to cause further harm. You will be safe. You will get through it. And you can kind of develop some mantras about, this has come and it has gone in the past. I will get through it, that kind of thing. What maintains the panic is when we actually get anxiety about the anxiety, and we kind of create this cycle of, oh, another one's going to happen, and we can end up creating a panic attack. So we just need to remind ourselves that we are safe and we have skills to get through it. Mindfulness, someone wrote in the chat, is also very useful, to just be paying attention to how we're feeling and, try to take a moment to bring ourselves to the present moment, because we often get so anxious about all the appointments we have upcoming and preparing and, speaking as clearly as I can, that we can really rev ourselves up. But if we can focus just, on the here and now, even momentarily, that can help to reduce anxiety slightly. None of these things are cure-alls, but if you can kind of combine different sets of skills or practices, it can help in the moment. Lots of good examples in the chats. Yeah.
Yes, there are tons of examples. Jennifer?
Can I ask Brooke something? So, like, one of the things that that I think helps some of the providers, I'm not a provider, a medical provider, so I notice a difference between like some of the fellows or the students or interns versus the seasoned doctors. And that's not all seasoned doctors, but there's, going back to what you stated, America, sometimes when I'm standing up for myself, I'm in my head trying not to come off as the angry Black woman, right? So, but I'm trying to, be heard, right? So what I notice is there's this genuine passion and love for what you do with the younger doctors. They just don't have the, all of the practice and the career behind them and all the experience, right? Is there anything else that helps that we can do as patients at all?
are you talking about when you're dealing with maybe some of the seasoned doctors that don't feel have that
Yes, the
passion?
ones that have a bias or,
Yeah, yeah,
have, a different pair of lens on and may, reset that trauma or bring on that,
yeah.
past experiences.
Mhm. Sure. And so in addition to what you've already said, I think about the power of just sharing, personalizing it and using, I statements. Like, I'm feeling blank. I'm feeling angry. I'm feeling frustrated. I'm feeling unheard. And it's a really good way to not initially set the other person on their defensive. You're not saying you're not listening to me. You're saying how you feel. So I'm feeling frustrated. Can we take a break? And that might be a way to cut through enough to not kind of further inflame a relationship. It's kind of like bringing your own humanity into it. And I know that might feel a little trite. That's one idea I have off the top of my head, because it is hard. People get on autopilot, especially seasoned providers, and they don't often take a time to recognize, like, this is a new patient in front of me with their own set of experiences. And it can happen with younger patients as well. Or sorry, younger providers as well. But yeah, in your experience, you've seen it kind of the season. I'm curious if Karys has had that experience too, with like generational differences with providers, because I'm having a harder time come up with other ideas.
Yeah, I think also like my big thing is where I was so young, they kind of blew me off and they were like, well, she doesn't know what she's talking about. And I almost had to start getting kind of stern and not, sounding so childlike was a big thing for me. And I think another kind of aspect as that or to that as well is if you can take one thing I've said from this whole thing, finding people who are going through similar situations as you is the most important thing. I truly don't think I would have made it through what I went through if I hadn't had found people who are going through it, because as much as your parents are there, as much as your friends are there, they truly don't understand what you're going through. And my biggest thing I would use to get in arguments with my mom in the hospital is, and even doctors, when they would say, like, I understand what you're going through. And I'd be like, no, you actually have no idea what it's like to be 15 and missing out on experiences and friends because you're stuck in a hospital room. But finding those people, even if it's not the same disease or same chronic illness, just people who understand what it's like to kind of live in a hospital and bounce ideas off of. I mean, I know when something goes wrong, like we have a pancreatitis group chat from Camp Hope, and I like will shoot messages and they're like, hey, I'm going through this, like anyone has experienced this, like let me know, and kind of getting ideas so you're prepared before you talk to the um providers. But as much as I never wanted to come off as like a little hateful child, I know there were some times that my emotions would get the best of me and I needed them to take me seriously, and that was kind of the only way that I got their attention, was getting stern. And not, you don't ever have to be hateful, you don't have to cuss out the providers, but getting stern and saying, listen, I know what I'm going through, this is my body, I know my body better than anyone else, and so I need you to take me seriously and we need to get stuff done.
That's so important. And everything that you're talking about, and everything we've talked about today. Dr. Palmer, some of the tactics that you were talking about as well, like the mindfulness and the grounding, oftentimes we overlook those as really simple tools that may not work, but they actually do work. They do a lot to help us regain composure, emotional composure of whatever we're experiencing. And within that same vein, I think too often chronic health conditions are, popped in a little corner. Your experience is this, you can't experience anything else. And then within that, you're also really struggling with your mental health. And so having to navigate, is it anxiety that I'm feeling? Am I depressed by the diagnosis I received? Are there other things happening in my life? All those things are really important to this overall process. And if you're in that space and you're navigating, you're not sure what's going on, Mental Health America has free resources that can help you think through that. So you can take free mental health tests on our website. They're free, anonymous, confidential. you can go to mhascreening.org and find some really helpful tools. Now, I know we only have about 5 minutes left, and we've had a bunch of questions come up. So if you have not put your question into the actual Q&A box, please feel free to do so now. Make sure you highlight, like, if it's a question for me or Jennifer or Karys or Dr. Palmer. We do have one question. It's for Jennifer. They ask, how does Jennifer handle the seeking comments as a Black woman? Not exactly sure what that is talking about, but maybe
think it's like
seeking.
drug seeking
That's what I
comments.
was thinking. Yeah.
Mhm.
So Jennifer, how do you navigate that?
I stick to the facts. So I'll go back to, well, if you look at my medical history, there's a difference between, you know, like Kara said, pain management or seeking uh, a specific medication. Because there's been times they'll do trick questions. They'll be like, okay, especially in the ER, is there a particular drug that you want to use for pain management? No, whatever you think is best. I just project back because you're the expert.
Mm-hmm.
I'm relying on your expertise to help with this particular situation. So it's not about a particular medication or particular anything. But yes, I have experienced that quite a bit.
Mm-hmm. That's a very good, I think, way to help people level set, right? These are the facts. Please take time to read what's in my file so you understand the experience that I'm coming into the situation with. And sometimes there isn't time for that, but we also have to be be inclined to pause if we can, right? Which sometimes is a luxury, but to be able to say, wait a minute, please do this, right? There's another question is, how do you overcome the stigma of being mentally ill when talking to doctors, or for them to not write you off as crazy or a hypochondriac? And I think kind of both of y'all have kind of referenced this already, right? That the biases that people come into these spaces with are so important. And most often they're not evident until there is an interaction that says, wait, why did you think that? Like, what did you see in my person or my file that makes you believe this? Right. And I think for that, it's important, again, to stick to the facts and push people to that. But Karys, Jennifer, do you have other thoughts to add? Karys, you're off mute. So
Yeah, I was gonna say one of my big things that was so hard for me to comprehend and that I eventually did, and it did kind of help out. When they're coming to the mental health aspect, open the blinds, get outside more, stretch, wake up at a certain time every day, stay out of your room until you go to bed at night. Actually do them and take that advice, because then when they say it next time, you can say, no, I've done everything you're asking me to do and we're still not getting answers. That was a big thing for me, because then they're kind of like, oh, well, she did try them, so maybe there is. And I would even literally like record myself doing them, because sometimes they wouldn't take my word that I was like, here's me vlogging, I'm up at 8 a.m. this morning, like here's me going to the gym, like stuff like that, like just so they know, like, okay, she is trying what we're saying. And I think sometimes providers, want to have that kind of control. And so doing it, and, you're listening to them, but then again, you're not getting answers. So you're trying everything they're saying, but now we need to go a different route because that aspect isn't helping anymore.
definitely. We have 1 more minute left, and I'd like to take that minute to just say thank you to all of you for spending time with us today, and being vulnerable to share your stories. I think the impact has resonated with the community that's joined us today based on all of the feedback that we've received throughout the conversation. And Dr. Palmer for not only helping us understand the perspective from a medical provider, but being also a provider that really takes this to heart and wants to create a safe space for folks. Just so everyone knows, what will happen is that an email will be sent with a YouTube channel where you can access this presentation later in the future for anyone that has missed it or anyone who wants to rewatch it. And you can always come back to our organizations, both NPF or MHA, for tools that may help you along your journey, finding support systems. And again, just thank you all. I don't know if Dr. Palmer or Jennifer Karys have anything else to add before we end.
Thank you for inviting me and us.
Yeah, I was just thank you. And I'm glad that we were able to talk about both conditions as they play on one another. So we're just in this journey together. So thank you.
Thank you, Jennifer.
Yeah, I was just gonna say, like I've said before, your body, you know your body more than anyone, so continue to advocate for yourself, and there is light at the end of the tunnel, no matter like how dark it gets sometimes. There is light, so just keep pushing through and advocating for yourself and believing in yourself, and don't let yourself get in your head, because you know yourself better than anyone.
Thank you all. I hope everyone has a wonderful day. Thanks for joining us. Bye-bye.